Rhino Orbital Cerebral Mucormycosis. It is a rare but serious fungal infection caused by fungi belonging to the order Mucorales. This infection primarily affects the sinuses, eyes, and the brain, and it can be life threatening if not promptly diagnosed and treated. Causative agents. The most common fungi responsible for the mucormycosis include species from the genera Rhizopus, Mucor, and Rhizomucor. These fungus are ubiquitous in the environment and can be found in soil, decaying organic matter, and on various surfaces. The risk factors include diabetes mellitus type 1 that causing ketoacidosis, hematological malignancy, solid organ or stem cell transplantations. These are the main risk factors. Individuals with weakened immune systems are at higher risk of developing mucormycosis. This includes people with uncontrolled diabetes, organ transplant recipients, those undergoing chemotherapy, and individuals with conditions that compromise the immune system. The spores of this fungi are inhaled, and the infection typically starts in the nasal and the sinus passages. From there, it can extend to the eyes and in severe cases reaches the brain. The symptoms are as follows: nasal congestion and discharge, facial swelling and pain, eye symptoms like redness, swelling, and visual problems, headache, fever, altered mental status in cases where infection reaches the brain. Diagnostic methods include imaging studies such as CT scans and MRI to visualize the extent of the infection, tissue biopsy to identify the causative fungus. The tissue biopsy can be done by sinus endoscopy. The urgent surgical intervention to remove the infected tissue and control the spread is needed. Antifungal medications such as amphotericin B to combat the fungal infection. Addressing the underlying health conditions contribute the immune suppression. The prognosis depends on the factors such as the patient's overall health, the extent of the infection, and how quickly it is diagnosed and treated. Prompt and aggressive treatment is crucial for a better outcome. Preventive measures include controlling underlying medical conditions, maintaining good hygiene, avoiding environments with high fungal spore concentration. Also, controlling the diabetes are the main preventive factors. In your board exams, the question could be: the patient who has type 1 diabetes mellitus come to the hospital for DKA, and then suddenly he developed fever, periorbital swelling, and necrotic nasal turbinate. That should arise suspicion for Rhino Orbital Cerebral Mucormycosis. And the sinus endoscopy should be ordered so that the tissue can be we get the biopsy, and then we can send it to culture. The treatment would be early surgical debridement as well as starting with lysosomal amphotericin B. Once clinically improved, amphotericin B can be transit to several weeks of step-down therapy with oral antifungal medication, for example, pasoconazole. Thank you.